pandemic killed and infected many, and as a result of this, we learned many positive and negative things from this. Hi, my name's Alan. I'm a third-year medic at the University of Birmingham, and welcome back to the Aspiring Medics YouTube channel. Today, we'll be talking through a scenario that could come up in your medical interview, and this is what the question could sort of sound like.
How has the COVID-19 pandemic changed the NHS for better and for worse?
So let's rewind back to 2019 when the COVID pandemic first hit. This pandemic killed and infected many, and as a result of this, we learned many positive and negative things from this. So let's talk about the positive things first. I would like to give you a minute to just think about the positive impacts of the COVID-19 pandemic, and then we'll move on to the points that I've already prepared. I've prepared 2 points. The first one is about teamwork and resilience in the NHS. As a result of the COVID-19 pandemic, teamwork and resilience improved in the NHS. Healthcare professionals banded together to provide a better healthcare experience for patients that were in at the time. And this has also continued to improve in the future, which is now as well. The second point that I'd also like to talk about is how innovation took off in the COVID-19 pandemic. Innovation took off starting off from a GP perspective because more online appointments were introduced into the GP clinics, which allowed for easy accessibility for patients if they want to talk about their conditions or something that might be going on. It also meant that more patients were able to be seen in a shorter period of time. Now let's move on to the negative impacts of the COVID-19 pandemic. I'd like to give you a second to just think about what these negative impacts could be, and then again, I'll talk through the 2 points that I've got ready for you. So let's talk about the 2 main points that I've prepared. The first one is the massive backlogs that we see in the NHS. Getting an appointment now is very difficult, and millions are still waiting for the care that they need, and this could take years to fix. This second point that we can take that is a negative impact of the COVID-19 pandemic is how healthcare professionals' mental well-being has deteriorated as a result. Long working hours, increased pressure, stress, and other conditions that might have arisen as a result of this pandemic may have led to a decreased function of the NHS and lower well-being, which we still need to improve and are looking to improve in the future. So now that we've talked about the negative and the positive impacts, let's look at the long-term reflections that we can take from this. First one is the innovations that we already talked about can be prolonged and used in the future. For example, more people using the NHS Health app, but also the use of GP consultations that have now moved online. Another thing that I'd like to talk about is the introduction of new roles to help alleviate the pressure that is on the healthcare system. The introduction of roles such as physician associates have helped to reduce the workload that is put on both doctors and nurses and help with diagnosis and understanding different conditions that are currently around. Finally, another long-term reflection that we can take from this is that there's a stronger voice for public health. This is in the sense that we kind of act like a feedback system. So patients will tell us what they could improve about their care and what we could do better. And this will help the healthcare system to improve, understand, and provide more patient-centered care in the future. So in short, COVID didn't just test the NHS, it also helped transform it, providing a better place for healthcare professionals to be, and also understanding patients' needs and what they need. So now that we've talked through long-term reflections and positive negative impacts, I do realise that that is a lot of information to put on you, and it might be difficult for you to remember that, but don't worry. You can talk through the ideas that you remember and the key points that we've tried to talk through. Even if you don't, reason things out and try and produce the best answer that you can to help you with your medical school interviews. Thank you so much for watching this video. I hope you liked it. If you did, give it a like. Share it to your friends that might be going to another medical school interview and subscribe. Thank you very much.